Hello friends, how are you? This is Dr. Shinagi, Ayurveda medicine doctor and also Isha Hatha Yoga teacher. So today in this video we are going to talk about how Ayurveda can help in bronchitis, how we should have our lifestyle if we have bronchitis, especially chronic bronchitis. We all are aware of bronchitis, especially those who are bronchitis patients, means those people who have inflammation in the bronchus. That means they have bronchitis. And bronchitis, as we know, it is of two kinds: acute bronchitis, which get cured with medicines, or sometimes sudden acute bronchitis we have, and we go to doctor and they give some azithromycin or some kind of broad spectrum they give, and we get cured. Earlier days when we were children, there was no azithromycin was there, so people were giving penicillin injections in small towns. So it is just like that. You take antibiotic, some broad spectrum antibiotic, and that bronchitis get cured. But there is another kind of bronchitis that is known as chronic bronchitis. Chronic bronchitis means even if you take antibiotics, it doesn't go. It's the symptoms subside, but it doesn't get fully cured. And in these kind of problems, which are chronic in nature, the only remedy is lifestyle and some Ayurveda herbs. So let's see what is the explanation of bronchitis is there in Ayurveda, and how we can use Ayurveda knowledge and lifestyle knowledge that will help to deal with this chronic bronchitis. Now, many of you must be asking, oh, so that means bronchitis has been mentioned in Ayurveda. At that time, bronchitis was discovered because all Ayurveda is written in Sanskrit. So, is the terminology bronchitis is being used in Ayurveda? In Ayurveda, bronchitis as a terminology has not been used, but there are diseases that are mentioned in Ayurveda which have exactly same symptoms as bronchitis. And in Ayurveda, as we all know, it is written in Sanskrit, it is not written in English. But the symptoms that are mentioned in Ayurveda, which are very similar to bronchitis, that is Kasarog or Tamakswas. These are the two terminologies, but most of the people are not familiar with Ayurveda terminology, and most of the people do not know Hindi or Sanskrit. So definitely they can't relate with it more. But English is like worldly spoken language and everybody knows what is bronchitis. So I will use the terminology bronchitis, not like tamakswas or kas, not like that, because people will not understand it. But we will take the formula from Ayurveda. What are the things that can help in this bronchitis? So in Ayurveda, it is caused by excessive or aggravated vata dosha and kapha dosha, causes the obstruction in respiratory passage. Now this obstruction can also be in form of kapha dosha, like inflammation is happening, or some obstruction because of vata dosha, which cause wheezing sounds. So all these things are very similar. So let's not discuss more into the disease physiology. Let's go with the remedies which are useful for us in our lifestyle, which can we adopt in our life to deal with the disease. First, we need to understand what are the things which aggravate the bronchitis. First thing is cold food. Whenever you take any food which is cold in nature or cold in like post-digestive effect is very cooling, that will cause aggravation of bronchitis. If you're living in an area where a lot of dust, toxins are there, like metropolitan cities where weather is containing a lot of dust, smoke, toxic air, where bad AQI of the air. So in these places, bronchitis is very common disease. Pollution also impact it, and improper digestion also make impact on bronchitis indirectly. Whenever you are taking any food which is too much vata aggravating, it will aggravate the bronchitis. If you're taking a lot of cold potency food which is kapha enhancing, that will also aggravate the bronchitis. In Sushruta, it's been also mentioned regarding bronchitis, but in Sushruta it's been mentioned about narrowing of the passage of our breathing. So in those cases also, if there is some kind of narrowing too much of bronchial passage, that can also cause discomfort and inflammation, that can also lead to bronchitis in some cases. Now we all know the symptoms of bronchitis like chest stiffness, not able to breathe properly, discomfort, wheezing, chest congestion, and it become worsen at night or with cold exposure. So what can we do? This is all theory. Most of the people are not even interested in it. So what can we do? So first thing is, never take any food that is cold in temperature. If you are taking, never take water from the refrigerator. Take water at room temperature or lukewarm water. All these ice creams, cold drinks, soft drinks, which are directly chilling drinks, chilled stuffs, these things you should avoid if you have chronic bronchitis. These will make huge difference. If you are taking curd at night, totally avoid it because it will cause toxins in the system. Avoid pollution, dust, or like toxic air exposure. Go to the place where clean air is there. Avoid daytime sleeping if you have bronchitis because it will enhance the kapha dosha. Excess of sweets and too much oily or fried food will also aggravate bronchitis. Then what we should do to reduce the inflammation? Pinch of turmeric with the Himalayan salt in warm water that you can drink at night or in the morning empty stomach. After food also you can take it. Steam inhalation is must if you have bronchitis at night before sleep. After doing steam inhalation, don't go out in cold. Black pepper and honey in combination you eat either in the morning or in the evening. If you ask like what kind of teas are beneficial in bronchitis, that is tulsi tea and ginger tea. If you ask me what are the panchkarma therapies for it, it is Vamana therapy for if the bronchitis is caused by kapha enhancement, then there is a Vamana therapy to remove the excessive cough mucus. But this should be done only under the guidance of Ayurveda doctor. In Ayurveda, lubrication of the nostrils, that is also known as nasya, that is been recommended in bronchitis. It will help to open up your passages. This lubrication you can do with almond oil. In addition to that, fumigation or dhumpan it is called. It doesn't mean smoking. It means fumigation with herbs. It will purify the environment and provide relief to the bronchitis person. And some external therapies for chest stiffness and cold, that includes exercise, movement of the body, and active lifestyle. If you ask like what are the Ayurveda rasayans that are best for chest, that is Pipali rasayan. That means Piper longum, especially the powder of Piper longum with little bit of honey, it will provide strength to your chest and it will reduce the kapha, that is mucus. Another anti-inflammatory plant is Vasa, which acts as anti-inflammatory and bronchodilator, or it helps in bronchodilation. In addition to that, do yoga, pranayam, deep breathing. These are very, very important. Try to have freshly cooked food. Avoid all the causes which aggravate the vata dosha. In my channel, I have created a lot of videos with which reasons vata dosha get aggravated, like tin can packed food you should not eat, freshly cooked food you should eat, within 3 hours of cooking you should eat, refrigerator things you should not eat. So these are vata balancing diet. And all these things like excess of sweets, too much of sugar, processed sugar, milk, all these things will aggravate the bronchitis. So all these things you try to avoid and try to have early dinners if it is possible, not very like late at 10 or 11. Try to eat by 7, and this will also help you to heal your bronchitis naturally. In addition to that, yoga, pranayam, breathing practices, these are very beneficial if person wants to heal from within, especially in bronchitis. If you have any questions, please write down those questions in the comment section. I will try to answer your questions in the best possible way. So that's all for today's video. Thank you so much for watching. And if you're watching me for the first time, there is a bell icon, there is a subscription button. Please click the bell icon, hit the subscription button so that you stay in tune with our upcoming videos. Also, if you would like to support us, there's a join button near subscription button. You can click this join button and you can support us. Those of you who want Ayurveda consultations, please write to me on this given email ID and I will let you know how we can schedule it. So with this note, I would like to say stay healthy, stay blessed, take care. Bye.